Hello, everyone, and welcome to Harmonizing Health, the transformative power of the arts and maternal well-being. Prudential presents North to Shore production, produced by the New Jersey Performing Arts Center. My name is Ali Meyer Lakuda, and I am the Senior Director for Arts and Wellbeing here at the Arts Center. And I thank you all for joining us today. To get us started as an opening performance, please enjoy this video of Colleen Bonney and her family singing the lullaby that they wrote as part of our most recent edition of the Lullaby Project, a program out of Carnegie Hall. Thank you. All right, thank you, everyone, and thanks for your patience with some of our technical difficulties there. But right now, I would like to introduce Shanae Harris to welcome us into this presentation.
Good afternoon, everyone. Again, my name is Shanae Harris, and I am Head of Social Responsibility at Prudential. We are excited to welcome you here today as the title sponsor of this year's North to Shore Festival. Prudential is proud to partner with NJPAC in this celebration of diverse talent and creativity in our home city of Newark and throughout New Jersey. We value our long-standing partnership with NJPAC. Arts and cultural institutions are drivers of economic impact and help to foster vibrant, thriving communities in Newark and cities across the state. The arts can also serve as an innovative healing tool, providing a creative outlet during life-changing moments, and in today's case, motherhood. This creative spirit sparked the first North to Shore, conceived by Governor Murphy and the First Lady last year. So it is with great pleasure that I introduce our First Lady, Tammy Murphy, who will moderate our panel today. And I'd like to thank the Governor and the First Lady for the work that they've done to bring health and prosperity to the state and our hometown of Newark. Prudential has worked closely with the Governor's administration for many years. And on a personal basis, I've had the honor of working with the First Lady on the New Jersey Pandemic Relief Fund and saw firsthand her commitment to ensuring that every New Jerseyan has access to resources to lead healthy, productive lives. First Lady Murphy has also been a tireless champion of improving maternal health in New Jersey, especially for vulnerable residents. So as a mother myself, I am looking forward to this conversation. I also want to acknowledge the panelists for the amazing work that they do to combine the arts with well-being to ensure that every child born in the state of New Jersey has a healthy start. So I am now honored to welcome Tammy Murphy, First Lady of New Jersey, to our virtual stage as she kicks off today's discussion. Thank you.
Thank you, Shanae. It is always a delight to see you. Hello, everyone. As Shanae said, I am First Lady Tammy Murphy. Welcome to North to Shore's Maternal and Infant Health Panel, Harmonizing Health. Before we get started, I want to thank our mom performer for sharing that beautiful song and baby with us. I am absolutely thrilled to host today's panel discussion and introduce you to our panelists. But before we get to any questions, I want to take this opportunity to share a little background about New Jersey's maternal and infant health crisis and our work to transform this state into the national gold standard for maternal care. In 2018, when Phil first took office, I learned a few things that really horrified me. First, the United States is 55th in the world and the absolute worst of all developed countries for maternal mortalities. And second, New Jersey was appallingly ranked 47th in the nation for maternal mortality. Even more disturbing, this ranking was the result of extreme disparities in outcomes. At that time, a Black mother was nearly 7 times more likely than a white mother to die from pregnancy-related complications, and a Black baby was over 3 times more likely than a white baby to die before his or her first birthday. As a mother and simply as a fellow human being, I urgently wanted to change this reality, so I immediately began a listening tour across the state to better understand our maternal and infant health landscape. I met with health systems, government departments and agencies, physicians, doulas, community organizations, mothers and families, and truly any and all who made sense in this space. Those conversations have resulted in and continue to create significant policy changes, including in 2019, the development of Nurture NJ, our overarching maternal and infant health initiative, established with the sole mission of making New Jersey the safest and most equitable state in the nation to deliver and raise a baby. 2 years later, in January of 2021, we released Nurture NJ's strategic plan, which is our blueprint to help us reach that goal. And in the years since, we have moved up in our statewide maternal health ranking from 47th in the nation to 27th, and we have made meaningful progress, thankfully. A few of our really great achievements are as follows. We've enacted or made headway on over half of the more than 80 recommendations in our strategic plan. We became just the second state to expand Medicaid coverage to 365 days postpartum. We launched the most robust in the nation universal nurse home visitation program. And just about 4 months ago, we established New Jersey's Maternal and Infant Health Innovation Authority, the first and only of its kind in the nation. Our brand new government authority is dedicated solely to the health and well-being of mothers and babies, and importantly, ensures that this life-saving work will continue long after our administration comes to a close. While I'm incredibly proud of all that we have achieved so far, one major truth that we have learned over the course of our work remains true. From navigating systemic barriers to accessing quality care, to grappling with mental health issues and coping with societal pressures, the landscape of maternal health in New Jersey is complex and it's multifaceted. It is really imperative that we address these issues comprehensively and holistically, thus ensuring that every mother receives the support, resources, and care that they need to thrive and flourish during this transformative period of their life. Which brings us to today's panel. As the North to Shore Festival highlights, New Jersey is a hub of arts, innovation, and creativity with underutilized resources that many experts will affirm can positively influence health. Today, we will learn from our panelists about how they are leveraging the power of the arts to enhance maternal health outcomes, to promote holistic well-being, and to foster a supportive community for expectant and new mothers. And so now it is my honor to begin our panel. I am sure all who are watching would love to know a bit about your backgrounds, so please feel free to introduce yourselves as we begin our Q&A. Our first question is for Tiffany. Tiffany, I wonder if you can tell us a little bit more about the Lullaby Project and how it came about, and maybe what you have learned about its impact on maternal and child health.
Hi, thank you. So I'm Tiffany Ortiz. I'm the Director of Early Childhood Programs at Carnegie Hall in New York. And one of our largest early childhood programs is the Lullaby Project, which began in 2011 in collaboration with New York City's health and hospitals. We were working with Jacobi Medical Center on a range of musical experiences at the hospital. And this songwriting project essentially pairs caregivers with a musician to write a personal lullaby for their child, expressing their hopes, their dreams, their wishes, to pass on their cultural wisdom to their children through the form of this beautiful lullaby or love song that becomes a generational gift for their child and perhaps their grandchildren and beyond. When we started this program, it really was in response to a healthcare need. In conversations with staff at Jacobi Medical Center, it became clear that there was a real need to support young parents who were experiencing high levels of stress, which was impacting their ability to bond and connect with their children. And we wondered what role music could play in supporting the well-being of caregivers, as well as that bonding process between caregiver and child. And that sparked a series of conversations with the healthcare staff, with our musicians, and with the team at Carnegie Hall to pilot the very first Lullaby Project in New York City. Once we began this work, we started to see real benefits to the caregivers and the child and that relationship that they were fostering in those early years. I'll speak a little bit more to that, but I want to just mention that after we began this work in the healthcare space, we began to expand to social services, to the justice system, and supporting a range of families and caregivers across New York City. And now we have about 60 partnerships globally where folks are adapting this work to meet the needs of their mothers and their families in a culturally sensitive way. So we see many, many iterations of the Lullaby Project, and I'm happy to say that we are partnering with NJPAC to bring this program to families in New Jersey. And we hope to continue to see this work thrive in supporting the artistic community, but also really using and leveraging music and that creative songwriting process to support the well-being of our caregivers. Through our early evaluation, we started to see the real impact that this work was having. We thought it was a beautiful idea to write a lullaby. Lullabies are culturally present in many, many cultures around the world, but to really embark on this really unique creative process with families opened up a lot of space for reflection. Our families reported feeling a greater sense of well-being, a sense of accomplishment and achievement in their lives, and a closer connection to their children. And it's been really great to work with evaluators on this work. And quite frankly, there's robust research and evaluation that exists that points to the impact that infant-directed singing can really play in supporting the well-being of caregivers, mitigating stress, reducing levels of depression in postpartum, seeing the real impacts that it can have around a sense of achievement and accomplishment for our caregivers, and that attachment process between parent and child. And we know that music, infant-directed singing, can support the well-being and the thriving of our young children as well. So supporting their early brain development, their sense of closeness to their caregiver, but also reducing stress for them as well, and soothing them through some of the tougher parts of parenting. So it's really been a beautiful project to see unfold. And as you saw from the video earlier today, many families are performing and sharing their experiences with others.
Fantastic. Thank you, Tiffany. And as you said, what a beautiful project. I am certain it is a blessing to all the mothers and babies who have participated. Okay, so our next question is for Ivelisse. Ivelisse, from the perspective of the partnership, what excited you about the possibility of bringing the Lullaby Project to your patients through the collaboration with NJPAC, and why was it important to offer this type of holistic care?
Great questions. So for those of you who do not know me, my name is Evelise Gonzalez, and I am the Senior Program Manager for Public Health Programs at the Partnership for Maternal and Child Health of Northern New Jersey. And basically to really echo everything Tiffany said, the thing that I loved about the Lullaby Project and, having the honor to work with NJPAC was that I loved how it bridged the gap between maternal and child health in the arts. This project offers an innovative approach to enhancing maternal-infant bonding, which is crucial for early childhood development and maternal mental health. Just the idea of creating personal lullabies gave families a powerful tool to express their love and emotions, which caused a reduction in stress and promoting a nurturing environment. The collaboration also allowed families to address their emotional and psychological well-being in a creative and meaningful way. And this experience was also, for me, and as well as the families, it was just so incredibly inspiring to see these families, step out of their comfort zone, do something that they probably have never done before, and work with an artist and create a lullaby, and then at a culminating event, get in front of an audience of people that they didn't know and perform their lullaby. And I personally don't think that's something I could ever do. So a lot of kudos to all of those families who did that. In terms of why it's important to offer this holistic piece of care, I feel like it addresses not only the both physical and emotional aspects of motherhood, but also the psychological well-being. And it causes mother-infant bonding, and, it works to reduce stress by utilizing a creative outlet, which in turn promotes overall health and development comprehensively and compassionately. So I was very excited to be a part of this, and I look forward to doing this again in the future.
Thank you so much, Evelise. It's always great to see you and to partner with you. So thank you for being here. We are learning more and more about the complexity of maternal health. So it does make perfect sense that holistic care is essential to helping our moms thrive. So thank you for that. Okay, our next question is for Lisa. Lisa, I wonder if you would please tell us more about the RWJ Barnabas and Vogel Center and what services it offers to birthing parents. And then maybe you could talk about how you've witnessed artistic expression contributing to the overall well-being and resilience of mothers, particularly those facing socioeconomic challenges.
Thank you, Tammy. I'm the only one without the background, but that flies right in my norm for me showing up to things. It's been so exciting to hear everything you're saying about New Jersey and the numbers decreasing, and wanting to be the first state that is going to lift women pregnant and postpartum up, both medically, physically, as well as I hope emotionally, and with maternal mental health. That's what we have here at Robert Wood Johnson. It's the only one in New Jersey. It is a utopia for mothers and babies who are pregnant in the first year after delivery, who are experiencing loss or infertility. We treat the whole family because we know that it affects the whole family. So there's many options for mother and baby. Music is every week, and it's just a beautiful sight to see a mother who is sure she's not bonding, like Evelise said, with her child, have a positive experience, and it validates that she is doing the right thing in such a simple, I don't mean small, but simple way. And they're a different woman coming in than they are when they leave. using music, using art. We have a creative arts therapist. We use Sand Tray as a therapy. We have Mom Mentor Fridays where they bring in a craft and teach it to someone else. We know that it allows a vulnerability when moms are using their hands and not thinking first with their minds. And because it's a mother-baby program, all the babies are in the room and feeling that energy as well. We've only ever seen positive experiences from our daily classes. And we treat thousands and thousands of women and their families every year. We've been doing it since 2017, and we are constantly getting at least 10 calls a day for more women that need help. Oh, and let me say, because we are part of a hospital system, we have no problem with access to care, because it's whether it's Medicare, Medicaid, charity care, or private insurance, everybody is treated the same and gets the same treatment. And that allows us to treat anybody anywhere who is suffering from perinatal mood disorders.
Thank you, Lisa. I am really so grateful that this center and program both exist and that parents are able to use art therapy to process their experiences. I actually came into contact with the Sand Tray therapy treatment. It's so interesting to me. Yeah. But anyway, thank you. I'm glad to hear more about that.
Thank you.
Yeah. Okay, so our next question is for Tanya. Tanya, I wonder if you can share how your experience as an OBGYN led you to the arts as a vehicle for advocacy, and what impact have you seen from using the arts to raise awareness?
Thank you so much for having me, First Lady. I am so honored to be a part of this collective effort. I am Dr. Tanya Wright. I'm actually a board certified OB-GYN as an assistant professor right now at Penn State College of Medicine, so your friendly neighbor over in Pennsylvania. I am a division chief of the academic specialist in OB-GYN division, and I do practice full scope women's health over the lifespan of the woman, but I'm boots on the ground, providing maternal care for patients in the community. At my institution, I have spearheaded efforts for bringing awareness about maternal health, especially the disparities and the crisis that exists. You alluded to it. But one of my passions outside of medicine, actually for about the past 10 years or so, is actually in collecting art, art of various media, particularly art of the African diaspora, and I share a large collection with my husband. My husband and I have now found a way to actually mesh both of these worlds of healthcare, maternal health, as well as the arts through an establishment of a foundation called the Right Now Art Foundation. During the COVID-19 pandemic, we decided to share our collection via social media, just as another avenue of kind of keeping our friends and family close to us when we could not share the physical space. And we really wanted to show how we live with our art collection, but through that, found ourselves showing how we use art for advocacy and awareness. And it truly has blossomed into something very large and beautiful. Now we continue to use our platform to further our mission. So with respect to your question, as an OB-GYN, I know intimately of the maternal health care crisis in this country. I'm so glad that you are doing this work, and I'm so inspired by the work that you're doing. As you mentioned, we know that the United States has the highest maternal deaths of all developed nations, and those numbers are only continuing to escalate. There's also a huge disparity in those deaths, not just the death, but the severe morbidity, so those near misses in Black patients compared to white patients at a rate that may be 2 to 3 times that of white women. The reasons are obviously multifactorial, but include things like structural racism and implicit bias. I have the moral responsibility. It is my duty to educate patients, to educate the public and my trainees. I train residents and medical students on this issue and what their roles should be and what their roles really are. And I have made this my life's work, and this is indeed my calling. Last year, we decided to commission 29 artists from around the world to create a piece of art of any media centered on the theme of Black maternal health. The works were so powerful. They really provoked a lot of thought. Really, the goal was to inspire action towards improving maternal health care, but it did so much more than that. We then brought those artworks to our home in Pennsylvania and exhibited them and invited collectors and our colleagues to view the work and an opportunity to purchase the work. And many of the works were bought, and we were able to raise over $100,000. From that, we used $50,000 to establish an endowment for Penn State, specifically to address the Black maternal health crisis, or really any at-risk patient populations in the maternal health space. And we're hoping that that fund will continue and can be used to fund research projects, for outreach, and community events, et cetera.
Dr. Wright, one second. I have a special guest who wants to just say hello.
Hey, everybody. Thank you so much for everything you're doing, folks. Great to see you all. I love the theme that you're talking about. It's fantastic.
Thank you so
Take
much.
care.
Thank you.
Okay, sorry. Back to your regularly scheduled program now.
No, and so it was just, I have the experience as a clinician, but truly being able to see the power that art has, as providing visual commentary on the importance of maternal health, advocating for better healthcare access, better support systems for our patients, and also just providing some societal recognition of some of these issues faced by birthing individuals, such as racism and bias, et cetera. So for us, we look forward to continuing to do art-related events for advocacy and for awareness, but also for raising funds so that we can better address these issues as time moves forward.
Fabulous. Thank you so much, Dr. Wright. And I just want to make sure you know we would love to welcome you here in New Jersey anytime. We would welcome you with open arms. So please come across the border. But art in so many different forms has long been one of the best ways, if not the very best way, to reach people's hearts and minds. Thank you for sharing, and I really appreciate that. So, okay, our next question is for Andrea. It's essential in this work to prioritize health equity. I wonder if you could tell us how you do this work contributing, or you see this work contributing to equitable maternal health outcomes.
Absolutely. Good afternoon, everyone, and thank you for the opportunity to participate. I think we need to step back and really understand what is equitable maternal health. Some of us might see that work differently, and it generally is around making sure that every birthing parent has the opportunity to experience a healthy pregnancy and childbirth, and that should be free from preventable risk and disparities. And the way that we work to do this is by making sure that there is holistic access to care, and that should be quality care. It should also be competent around culturally diverse and sensitivity. We also have to make sure that we're reducing disparities, and there has to be a proactive work around that. There should be holistic community support. And then there's always some work around addressing social determinants of health, and then policy and advocacy. As all of those concepts come together, we should be able to push and drive equitable maternal health. But we all know that no pregnancy is the same, and no barrier is the same, no social drivers for health. Even though there's qualifications on what they are, they show up differently for different people. And so this is where this concept of using art to help birthing parents is really, really impactful. And as we talk about this concept, we have to think about what holistic care is for the birthing parent. Generally, we think about holistic care as making sure that their birthing parent has access to a quality OBGYN, but holistic well-being or comprehensive well-being care extends past the birthing parent's experience with their OBGYN. How can we introduce community supports? How can we introduce other programs that really will support the birthing parent in their needs during this pregnancy journey and then well after? We know that a lot of birthing parents experience postpartum depression. And so it's not just getting through the 9 months, but it's getting through the entire journey. And leveraging art therapy could be a really impactful source in helping members and birthing parents get through the journey, but then also beyond the journey. We also know that from research that when the birthing parent is stressed during that pregnancy, it could have an adverse effect on birthing parent and baby. And so introducing art helps the birthing parent to really kind of manage that stress, if you will. Also, it gives them an outlet, it gives them a source, but it taps into their physical health, their emotional health, their spiritual health. And we've got to think about all of these things, not just getting through 9 months or 10 months of, expecting a child and delivering a child. Art therapy also helps for those birthing parents that may not necessarily have delivered a healthy baby. You know, we know that some babies do have, you know, developmental delays and other challenges, but this is where the concept goes well beyond just the 9 months. We also have birthing parents who may not deliver a child that will stay with them. You know, if we think about maternal morbidity and infant mortality, these are two factors that really are very impactful in terms of how that birthing parent will see their pregnancy and future pregnancies. So I definitely think that art therapy has a place in this world. And I would encourage everyone on this call today to take this as a call to action, right? Once we understand, once we know, once we've been educated, now we all have a responsibility to take that information forward. We all have a case where we've heard of someone who had a disparity during their pregnancy or after their pregnancy. We've heard of, you know, many challenges with birthing. And now we have another tool in our resource kit to really help birthing parents. So I want to encourage everyone, once you've heard about this today, take the message forward, because we definitely can move up from the 27th percentile, as well as our ranking throughout the state and the nation.
Well, thank you so much, Andrea. Achieving equity in care and in outcomes is a major focus of our maternal health work. So I'm incredibly grateful for your perspective. I also would love to add, you know, most people think that maternal mortalities occur either in advance of delivering a baby or as a baby is delivered. And in fact, more than 50% of them occur post-delivery. So this whole notion of keeping people calm and enabling people to have a vehicle for expression and for staying, you know, not getting nervous and not feeling stressed is just so crucial at all points in time during the pregnancy. So we actually have time for some further questions. So I'm going to just throw a question out and then maybe see how organized our panelists can be in trying to determine who wants to answer. Can you share any specific examples or success stories where creative interventions have played a significant role in addressing maternal mental health issues or even promoting emotional healing within communities in New Jersey? Anyone?
I can take this one. So I am aware of a community health center in Newark that did integrate art therapy into its maternal health program. So they were working with pregnant women and new mothers who participated in group art sessions, and they used paintings and drawings to share their experiences and feelings. And this provided emotional relief, and it helped build a supportive community among participants that promoted healing and resilience.
Fantastic. Thanks, Evilise. I think that Dr. Wright actually has something she wants to share. So Dr. Wright, over to you.
There are a very similar way that we use it here. You know, there are instances where during pregnancy, birthing parent has to be admitted to the hospital for extended periods of time. It could be days, weeks, sometimes months until delivery. And so, you know, that's really a huge psychological barrier for patients that are inpatient for a very long time. They're out of their routine, they're away from their families. And so we've incorporated art therapy as a standard part of their treatment for those extended stays, and it's kind of roped into their daily routine, and they can do crafting, they can do painting, they can do a variety of different things. And really the feedback that we've gotten, I think this has been pretty well established in the literature as well, is that it's such a great way to express complex emotions, which otherwise would be very hard to verbally convey. And not to mention, you know, the trauma that a lot of these women experience during pregnancy, prior to pregnancy, and after pregnancy, and having a very hard time articulating those traumas as well. And so just as an outlet, whether it's through listening to music, expression, sculpting, painting, sand creations, you know, there is certainly some therapeutic benefit as well. We've seen that as we use it in our antepartum patients here as well.
Great. Lisa, looks like you want to share something as well.
We did a first project last week with one of our psychiatric nurse practitioners who happens to also have a degree in art. How lucky are we? I know, she's new. And we had a group of 5 mothers that we had identified just needing a little bit more than 1 day a week care. So we did 4 days in a row building on each day. And the last day was vision board collage of what they perceived motherhood to be before they were pregnant or postpartum. And then some said the reality or the after. And they sat with each other. It was over 2 hours, and the same forms or pictures showed up in so many of the women that it was so encouraging for them to actually lean over, and everyone shared theirs to show that they were not alone, that the woman next to them, no matter who she was or where she was feeling the exact same way. It was so powerful. We're going to continue it.
Sorry. Okay, fantastic. Thank you so much. Those are really super examples. I wonder, I have another question for you. Given the diverse population and unique needs of mothers in New Jersey, how can we ensure that artistic initiatives aimed at improving maternal health are inclusive, culturally responsive, and accessible to everyone? Anybody have any ideas?
I can take it. I think it starts with spreading the word. So many of us, this is a new concept. When I think about it, I am one of 6, and my mother unfortunately lost 3 of her children. And that was a very real experience for her. For her, the outlet was the church. And that's what a lot of people did back then. You know, they used their faith-based community to really help to heal through some of those really tough pregnancies and what would happen after, losing a child. And so for her, it was the church. But now we have so many other resources that we can leverage to help get through a birthing experience or to go through a birthing challenge or trauma. And I think, again, we all are learning about this. And as we're being exposed to it, we have to take the opportunity to expose others to it. Within Horizon, we have a very comprehensive health equity strategy. And our strategy really focuses on disparities, and maternal health is one of those disparities that we're focused on. We're also focused on infant mortality. And in addressing those disparities, we're really focused on sharing resources. And this is one of the resources that we intend to share so that all of our members are aware that, holistic care is not just the service that they receive from their OBGYN, but also there's a ton of other community resources and support that they can tap in. The other thing that I want to express here is that art therapy doesn't necessarily mean that you sign up for a $200, $300 program. It's around finding, an artistic expression that is impactful for you. So singing may not be that thing, but writing could be, journaling, doing poetry, artwork. There's so many different forms of artistic expression that will help the birthing parent through their pregnancy and after. You could just really go to YouTube. There's a ton of stuff there, and you can pick up, skills and artistic expression that will help you, and then begin to share it. Find your circle that you can share it with, whether that's your immediate family or whether it could be your coworkers or just even your chosen family. Once you, use that artistic expression, you got to get it out and share it. And that really boosts just a sense of well-being. It also boosts, just a sense of calmness, and that calmness does help with, the pregnancy term. So I would say take it forward by sharing it. Everybody on this call and those who are expecting or know somebody that's expecting, have a one-on-one conversation and let them know this is a huge resource that could be leveraged.
That was very helpful, and I would just like to say that's a perfect segue to Ivelisse, given that she said she didn't want to sing in front of anybody else. Maybe she could journal or do something else that you've just suggested, Andrea. Ivelisse, I think you had something to add, and then I believe Tiffany does as well.
Absolutely. So I agree 100%. I do think that there's just so many different types of ways to express your artistic side. Singing is not my forte. I am not a good singer. But I mean, there's even power in doing like art therapy workshops, such as painting, coloring, drawing, any sort of visual art. There's power in storytelling and writing groups, dance and movement therapy, where patients can express their emotions physically, which can be great for those individuals who may have a difficult time expressing their emotions verbally. So I think it's about sort of figuring out what is going to work for you, the clients that you're working with, and then also engaging with all different types of communities and assessing the needs that they need, and then collaborating with local artists from different cultural backgrounds, making sure that the services that are being provided are multilingual, and making sure that they're also, that they're free, that they're accessible to everyone, regardless of income.
Fantastic. Tiffany?
You said so much of what I was about to say, Elise, and just bolstering the artistic workforce so that it is reflective and responsive to the communities that you're working with. Being within an arts institution, it's really important for us to collaborate with our healthcare providers, to collaborate with our communities, to really understand the families that we'll be supporting and their specific needs, and to provide, as Andrea said, options so that families have agency to choose a service that is in their language, that is reflective of their culture, that really resonates with them. That's going to have a really meaningful impact for them to be able to make that choice, and for those offerings to be provided at no cost is typically very helpful.
Andrea, did you want to add something else? Or?
No, I think they captured it.
Okay. I just want to give a shout out to Donna Dudek, who I just saw go across the chats, and she is suggesting laughter yoga, which I've never heard of before. So I have to now investigate whatever laughter yoga is. So listen, we have time maybe for one more kind of buzzer round question. So I'm going to ask perhaps each of you if you can help answer this one for me. So as leaders in health and arts, how do you envision leveraging your own platform to advocate for the integration of artistic expression into maternal health policies and initiatives? And I guess, what role do you see the government playing in supporting such endeavors? If you don't like that question, you want to answer something else that you just felt like blurting out, please feel free. But this will be our last round before I close this out, I think. Anyone?
I can start.
Okay, Elise, please.
So I think highlighting the success stories of how arts and mental health work, and they really can go hand in hand and provide such a holistic way of treating mental health issues. Continuing to show the research that highlights the benefits of artistic intervention, working with policymakers to integrate these practices into maternal health guidelines, and the government playing a crucial role by providing the funding and fostering partnerships between healthcare providers and artists to ensure these programs are not only widely implemented but also accessible to everyone.
Great. I want to just also point out for Dr. Wright and for Lisa, there is a question in the Q&A for you guys if you want to look at that at some point in time, either answer it here or go privately back. Okay, thank you. And Lisa, you're up.
Me and you, Elise. I was thinking that even though art should be free, so many things should be free, that these are professionals who are performing this work, and women who should still be valued for the job they're doing as creative arts therapists, or as therapists who've been certified in Santre therapy. And a program like ours that is able to have that covered by insurance leaves no payment on the mom's side, and therefore enables everyone to have, just like you're saying, choices of care, whether they're choosing sand therapy, or they would like to be in art therapy, or they want to go to the gift of baby sleep. Everyone can pick, like a buffet, what works for them, because no one is being charged, or no one is not having to be paid as a professional for doing it. The other way we use it here is, like you're saying, with trauma. I use it with our therapists, and we do a art project. We're starting it in July. We're building art journals, and we do prompts for 31 days. And then we come together as a healing to kind of dump all their stuff that they're handling each day with this population.
Tiffany?
I think for us at Carnegie Hall, we're really interested in using our platform to share the resources that we've developed at no cost to healthcare providers to arts organizations. That includes best practices around art facilitation within the healthcare space. We've adapted this program in so many ways, and so there's an opportunity to share key learnings through convenings and other platforms where we can share more globally. We've integrated Lullaby within NICU settings, within centering pregnancy, home visiting services, and postpartum depression services. So there really there's so many opportunities to collaborate, and we are very interested in networking and connecting with folks who are interested in bringing this type of programming to their community to add that to a range of offerings, hopefully. But really, we want to be able to have this conversation and to bring people together in the research evaluation space, in the art space, in the health space, to come together and really form an alliance around this work to promote best practices as we move forward and new opportunities. And certainly from the government support standpoint, we would love for further advocacy of the kinds of work that we are doing and leading. And of course, funding does make a big difference. Lisa, you are fortunate to have insurance cover the work, but that is not everywhere. And so we want to make sure that we provide support to our artists and to those who are delivering these services.
Well said. Okay, Dr. Wright.
I don't have very much more to add to that, but I did want to get to one of the comments in the webinar chat that I think potentially only came to the host and panelists. But essentially, this individual commented that it was really important to address burnout in providers caused by secondary trauma and moral injury so that they stay in the profession longer and support better access to services. And I really just wanted an opportunity to just kind of validate that point, because a lot of times when we're doing the work, whether it's as a clinician or with some of the services that you guys are providing, you can sometimes feel like you're on an island by yourself. And guess what? We too can benefit from having some of these outlets to express ourselves, to be able to feel motivated to continue to do the work. And two great examples that I found of this in my own experience over the past year was that I actually offered for the resident physicians that I train to participate as artists in the exhibition that we created to raise funds, to see if they would create something to convey a message into how their understanding of the crisis essentially. And one resident in particular used that opportunity to create a piece of work, which was actually masterful. It rivaled any other established artist work that came through for the exhibition. And we actually sold his work, and it was a hot commodity. And I think that was just so invigorating and motivating for him to tap into something that he did not even know existed, that he's truly an artist and he can convey his expression and his views through artwork, in addition to doing the work on the ground as a physician. That was number one. Number two, we actually had an artist who is a physician herself create an original piece of artwork that was a strong image of a Black birthing individual during pregnancy that we used on t-shirts and made widely available during Black Maternal Health Week this year. And again, they were so in such high demand because they were beautiful, but they were strong and they were powerful. We're getting images of people through social media doing selfies and sending us the image and just getting the message out and how important that message was. And that image was created by a physician. It is so important that we do the work, but we also stay connected to ourselves and the passions that we have, and use art as therapy for ourselves as well, so that we are, just kind of being true to who we are. So that's my contribution.
Fabulous. So, Andrea, did you want to say something?
Yeah, I can just jump in, and I just want to add to what Dr. Wright just said and just remind the entire group that this is a journey, and it should and will evolve over time. When we first started this conversation, we talked about where we were several years ago and where we are now. And fortunately, the work is moving forward in the right way, but there's still a ton of work that we have to do. And there's more outcomes to chase, and there's more information and education and access to care changes that we have to make, so that way this work can continue to move forward. And I think a lot of great work has happened, but we have to continue to think about what's next. And I think art therapy is a good conversation on what's next. And we all have to be advocates. And so I would say, in terms of what the state and the government can do, is stay a part of that conversation. It should never be looked at as a one and done. So now we're at 27, the journey's over, let's move on to something else. I think we're always going to have, birthing parents in the state of New Jersey, hopefully. So that means that there's always going to be more work to be done. And we need to think about this as a journey, and that journey should consider what else should we be doing for our birthing parents in New Jersey. Our therapy is an opportunity. Some years ago, we did a lot of work in the doula space, making sure that all of our health plans had access to doulas in our network so that birthing parents not only could, receive services from their OBGYN, but also from doulas and now, other resources as well. So the conversation has to continue, and we have to be very open with what that conversation looks like. And it's not just, we're going to send people into the home. That's a great new opportunity right now. So community health workers being able to go into the home of birthing parents to get support within that initial period after delivery, but also what else makes sense? What else can we do? How can we make this easier? And then also, how can we reduce disparities? How can we address clinical conditions that contribute to adverse maternity outcomes? I can't say it enough. It's a journey, and we all have to be a part of it. And we all have to do our own individual part to move this work forward. That's my final contribution. Thanks.
Well, thank you. Thank you all. That is just about all the time we have. So I want to thank our incredible panelists for taking the time to be here today and for their essential work on behalf of New Jersey's mothers and babies. As I said earlier, we are on a mission to become the national gold standard for maternal and infant care. And that requires taking an innovative, multi-pronged, and holistic approach to transforming our maternal health landscape. And there can be no question that incorporating the arts into our efforts will be a powerful and effective tool to help our mothers and babies thrive. We talk about all the time about how this is truly a partnership, and it's a partnership not only with the government, but it's a partnership obviously with healthcare providers, with insurers, with the legislature. I mean, look at the diversity of people who are on this call today, and the interests and those who they are caring for. We are so much more powerful when we really embrace all the diversity that we can all bring to the table, and we can really then be so much more effective in providing resources to all those who might be in need. So I truly appreciate all of you, and I love the fact that we've managed to get Carnegie Hall and NJPAC, and we've got Prudential Financial. I mean, we've got everybody on here. So thank you. So thank you again to the panelists, and to all of you who have joined us for this conversation. As I said, together we are making New Jersey the safest and most equitable state in the nation to deliver and raise a baby. Thank you all so much, and have a great balance to the North to Shore Festival series. Bye-bye.